Hi, and welcome back to Body Beautiful. I'm Janelle Marie. We are here today with Dr. Joseph Mealy talking about plastic surgery, and we're going to talk about thigh-plasty right now. Now, we haven't done this in a while. Thigh-plasty, first of all, what is it, and how do you do them?
So thigh-plasty is a thigh lift.
I love it.
So we get rid of mostly extra skin.
Yep.
So for someone who has tight skin and fat, we can usually do liposuction, but when the skin is loose, if you do lipo, it just folds over more.
Exactly.
Most of these patients are weight loss patients.
Okay.
So they've had their skin expanded with extra weight, and then as they lose weight, their legs get thinner, but the drapery starts to happen.
The excess skin is still there.
So in this case, we've got someone who has just a lot of extra skin on the inner part of the thigh. This type of lift was done through an incision at the groin, so along the upper part of the thigh.
Upper groin incision.
There's another way where you can run down the center of the thigh that goes from the groin down to the knee.
It just depends.
Just above.
Just depends how much loose skin they have.
Depends on where the loose skin is.
Gotcha.
And I kind of like this one better because you can hide the scar better.
Yeah, I mean, it looks great.
And you might notice her belly went away too. So
absolutely.
I did something else.
I think you did a tummy tuck with that.
Yes, I did.
So you can combine procedures.
You can combine them.
And
usually with the weight loss, you're combining, but tummy tuck thigh lift is probably about as much as I want to do at one sitting.
Gotcha. And you put the patient out?
Yes, patient's definitely asleep for these.
What's recovery period of thigh-plasty?
It takes a couple weeks. Can't do running, nothing too strenuous, but walking is always good.
Yes, get
Keeps
that
us
blood
out of
flow.
Trouble, decreases other complications. Second example, same thing. So again, her skin did pretty well shrinking up.
I know,
She's got a little bit of that.
She was a weight loss patient also?
Weight loss patient.
Oh, that is great.
But she was really annoyed by the skin touching.
Oh, yes.
So in this case, we've lifted things up, got rid of that extra skin at the top.
You got a little thigh gap in there, in this one.
That's what the people want.
Now, here's a good question. If you have that crepey skin that you get, maybe if you age a little bit, is it going to take away the cellulite skin, maybe the crepey skin?
Probably like hitting a hammer over something that's not going to get better with a hammer. So no. It's a big operation. It does sort of move things, but the crepiness is in the skin itself. So you just end up moving the crepiness.
So you're just going to have the crepey skin, you're just going to move it up?
Unfortunately.
I love that. Okay, so you got the thigh gap on this one. Picture number 3 is a little more involved here. So the third one is someone with
loose skin, and it went all the way down to the knee. And in those cases, that vertical scar up the thigh usually works better.
Okay.
So we can open up that space between the legs, give a little bit of thigh gap, but also tighten up the skin all the way down to the knee.
See, I think that looks really good. I mean, she did have a little bit of the loose cellulite skin looking on, and the after picture is nice and smooth.
It's better. It's still there. But it doesn't go away completely, but it definitely helps.
So thigh-plasty, I didn't know you could do that. So they are out there. So thigh-plasty can be done. I love it. And the scars really don't look that bad because you can hide them underwear or a bathing suit.
Yeah, the one on the top in particular.
The
one
groin
down the middle of the leg, you're going to see that, but it does something different.
But they will fade.
They do fade with time. And most of my patients just want to be flat. They're not so much worried about the scar.
All right, unfortunately, we are out of time.
I
hate that. We had such a great time on Body Beautiful. If you want more information, call the doctor, 925-943, what is that? 6353. Or go to sanfranciscobreast.com, drmealy.com, see all the before and after pictures. Thank you, Dr. Mealy.
Thanks for having me.
See you next time.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.